Okay, maybe we can go ahead and get started then. Are you guys ready? You're good? All right, we'll get started and so what we're gonna do in this session is I'm gonna introduce a bit of a framework, a bit of an idea of what we're trying to turn into something very real. And then we're gonna invite a couple of folks who are also excited about this to come up and speak and share their perspectives, Basoye specifically, and if Stephen or Peter come in, then they can share too. Um, and then we're going to open up for discussion. So, what are we doing actually? Well, we are trying to do something that I'm not really sure has ever been done successfully. We're trying to come up with an organizational structure, a partnership process that supplies the required resources for a global public good from the broad community of its users without putting up any paywalls or restrictions to access or use. Just to say, there are lots of open source products out there in the world. Tons and some of these, Linux Foundation, Red Hat, there's tons of them. It's somewhere along their value chain, there is a paywall or restriction that where they're able to derive resources to sustain their platform. It's either we do that or we do this because we have to figure out a way to sustain DHIS2 core. Okay. So what we have is you guys. We have a huge community. We have a massive implementation base of DHIS2. It's truly phenomenal how big DHIS2 is. Mike and I now have the job of basically trying to find out who all is using DHIS2 around the world. And I can tell you that it is so much bigger than what you know. There are so many use cases of DHIS2 out there that are not represented here, that are in places, geographies that we've never had contact with, but they're out there because it's open source, because anyone can grab it and do anything with it. They're happening, it's being used in industries that probably don't really align with our values. And we all have the added, you know, uh, uh, obligation to figure out how do we all come together, work together, and sustain what we have here, what this actually is, the global good. And I will say again, if we pull this off, as far as I know, and maybe the researchers can tell me, it'll be like the first time. So let's get into what we're actually thinking about here. And then again, we're going to try to invite some feedback and some conversation. And how do I go? Nope, wrong. So why does sustainability matter? DHIS2 is a digital global public good. You hear this all the time, but what does it actually mean? It means that we are non-rivalrous, right? It's a tough one. Meaning that you cannot prevent anyone else from using DHIS2, and we cannot prevent anyone else from using DHIS2. It is non-exclusive, meaning that anyone who wants to access it can access it at any time, right? The code, the actual platform. There's no barriers to access. There's no barriers to access to the code. There's no barriers to access to the resources. There's no barriers to access to our documentation. Okay? It is out there. It's publicly available. It is a good for the world. And this has been born true in its implementation. We're now in over 130 countries, DHIS2, as far as we know of. There's some maps, there's some countries here, like we know there's large scale implementations in the US and then probably also China that we have basically no connection with, also growing throughout Europe that we have very little connection with. So this map is actually, if we put in everything that we think we know, it would be a lot more colored in. And that means it's global. It's globally relevant. It's practically useful to everyone around the world. So it's not just a digital public good, it's a global digital public good with relevance to everyone. And maintaining that relevance to everyone is also extremely important. All the resources that we put out, all the material that we produce, all the guidance that we put out into the world, that needs to be globally relevant to everyone too. Yet the core platform funding is fragile. And I've been in lots of meetings and discussions, and people have said, "Oh, well, no, University of Oslo is great. It's fantastic to have the sovereign Norwegian sovereign wealth fund propping everything up." That is not how this works. Okay, we're reliant on donor funding just like most everybody else here in the room, right? And obviously, the donor landscape has changed radically in the last 6 months, and so it is fragile. The developers that we have, the training staff that we have, all the resources, the extension points that you're all using to innovate on top of and build new applications, all of this is fragile, and it has to be supported. And that means shared stewardship. We all have a stake in the maintenance and longevity of this platform, and all of the resources and extensibility and services that go on top of it. And so that's what we're trying to do, is establish collective action around the platform. And I know that like some of the researchers here are like, I cannot believe you're bringing this in, but I wanted to build off of kind of a couple of known proven principles. The first one is collective action. So this is economics theory developed by Elinor Ostrom and several others. In fact, she won the Nobel Prize in economics for this. That says you have a common good. Everyone in this room, everyone in this conference is benefiting from the common good, which is DHIS2. How do we collectively work together to maintain that common good? Right? This theory was built on the idea of like fisheries and forests and natural goods, right? Where there is like a very finite amount of trees in a forest. And if everybody's dependent upon using those trees to maintain their livelihoods, then yeah, you need to cooperate and collectively work together to maintain that reserve, right? That natural resource. The analogy can be stretched to us in that we are all in this room because in some way or another, we are dependent upon DHIS2 existing and continuing to exist. And not just existing, but also expanding and growing and introducing new innovations, allowing for AI and machine learning to come inside, right? That means that we all have a shared interest, and there's a common good there that we all need to preserve and work together on. We also, at the same time, want to try to make sure that we're avoiding what they call free riding. So a free rider is someone who uses the technology, uses the resource, and doesn't contribute anything back. That's open source for you. That happens. That's normal. That's actually should be a sign of success, that what you're actually building is useful out there. The challenge for us as the platform owner and you as the community is, how do we incentivize those who are already using it or thinking about using it to contribute back, to kind of buy into this collective action approach, right? It's not a problem of them to use it. Again, we're global good, we're public good, they can use it. The whole point is that they should be able to use it. The challenge that we all face together is, how do we bring them into the fold and say, okay, great, you're using it, but you also have to appreciate that it comes with an added responsibility of sustaining it. Now, the academics are going to really hate this slide, because I wanted to build in a little bit of an understanding of kind of the value proposition here. So if you don't really, buy the whole kumbaya thing, hopefully this will actually make it a little bit more tangible. So there's a virtuous cycle here around what we'll call contributions. This is all packaged up into a body of literature called service-dominated logic. Just Google Scholar search service-dominated logic, and it'll start to, you can get it. Or just ask ChatGPT to summarize it for you. You don't have to read stuff anymore yourself, right? So we have core contributions. And so what is a contribution? A contribution can be financial contributions, which we need more of. It can also be use cases, stories, code, applications, innovations, lots and lots of different things. Why did Norway start using DHIS2? It happened because Sri Lanka figured out a really good way of using DHIS2 for COVID-19, posted that on the community practice, and then Norway was like, great, that makes a lot of sense. We'll do the same, right? That story that Sri Lanka posted on the community practice about how to make DHIS2 work for COVID surveillance had more value to more people in the world probably than almost anything else in that time, right? Those kinds of things are contributions. They increase our collective body of knowledge. And we need to attribute value to them. So more contributions means that we have more innovation, we have more understandings, we have more financial resources to maintain everything. That means that the core is improved. So we keep our developers employed. We're sharing knowledge and insights. We're building out more resources and materials. And then that all, because again, everything is collectively shared, goes back to improving the services for DHIS2 implementers and adopters, right? That's most of you guys. So you now have improved services for DHIS2, which then feeds up to now a lot of you who are actually providing DHIS2 a service are going to be able to offer more services to your clients. Ministries are going to be able to do more with DHIS2. That's going to increase the value of DHIS2. That may increase, and then subsequently that spills over to more contributions. So you see this, in an ideal world, it's a virtuous cycle. And so what is the message that we want everyone to be saying? I put kind of two fictitious quotes here, but these are actually real things that I've heard people say throughout our research and interviews. The first one is, I want to contribute to DHIS2 because it is the right thing to do to support a global good, a platform ethos, a shared sense of responsibility, of reciprocity, right? It's the right thing. But if you don't care about what's right and wrong in the world, and there are plenty of DHIS people implementing DHIS2 who don't, then increasing or equally as important, you can say, and it increases the value of my organization and improves the services that I'm able to provide by contributing. So it's not just, this is a good thing for the world. It's by contributing, I'm actually strengthening my own position in the world because I'm using everybody else's contributions. But the most important thing here is trust and faith. I do this because I know other people are doing it. And because other people are doing it, I'm able to increase my own value. If I don't do it, then maybe I'm just free riding on what others have done. All right. So we're working on a new partnership model. This is still in, I won't say it's necessarily the early days, but we're definitely in a place where we're still inviting a feedback from it, which we want to encourage. So, well, we have a little bit of branding here. This could change. I had ChatGPT make this logo, so whatever. Just for the slide, I wanted to show a picture somewhere. So we're thinking of calling these the contributing partners, and the contributing partners can be implementers of DHIS2. These can be DHIS2 service providers. These can be potentially academic institutions who want to implement DHIS2 or utilize DHIS2 or conduct research around DHIS2. These could be multilaterals or donors or just, yeah, you kind of get it. It could be relatively large, but we think right now we're starting somewhat smaller with just all those folks who are implementing DHIS2 that we have not had a relationship with, a formalized relationship with, right? They are all going to commit to making financial or in-kind contributions. So again, in-kind contributions being not necessarily money to University of Oslo, but it could be like code or dev time or apps or innovations, that kind of stuff. We want them to participate in the platform governance because again, we're facing a big challenge right now. And we understand that more voices kind of helping steer the ship will steer it in a better direction, right? And we also want to make sure that there's a framework and an MOU connecting everyone together, right? And we want this to be the foundation of new types of relationships, not just between you all and University of Oslo, but between each other as well, right? DHIS2's been around for a long time. There are people, lots of folks who've been in here for 20, 30 years. There's a long established relationships. There's a lot of bad blood too. And I just address the elephant in the room. It's time to get over it, I think, to a large extent. Like, we need to work together and we need to find pathways and opportunities to work together because we're not going to address the challenges that we're seeing in international development financing unless we start to work together, right? So what are we saying in terms of commitments? This is all, again, very tentative. Please, you can take a picture if you want, but this could change tomorrow. Probably will change tomorrow. So we want this to be based upon, in terms of the contributions that people agree to, based upon, what are they able to contribute? How much are they able to contribute? We're now seeing that some countries are able to make direct contributions, right? Not necessarily low income countries, but some middle and high income countries are able to say, yeah, we would love to pay University of Oslo. We're implementing DHIS2. Just tell us how to, right? How much do they pay? How do they pay us? Right? We've got to figure this out. But we are wanting to make sure there's a structure for that as countries come on board. Again, there's 130 of them now or so, that they have a pathway to be able to make a contribution. Okay. Again, academic institutions, so lots and lots of university collaboration, sharing insights, sharing knowledge. Again, sharing knowledge amongst the entire community is probably the most valuable kind of contribution that can be made. Multilaterals and donors, DHIS2 service providers, private implementers, also HIS groups. Everybody is pitching in. Complementary platforms. So here you see, even just in this room, there's probably like 5 or 10 different complementary platforms represented just in this room right now. So things that are not DHIS2, but connected DHIS2. They extend DHIS2 into new spaces. They solve a lot of the problems that DHIS2 has, right? These folks, love to bring them in. Let's collaborate. Let's figure out how we work together. Let's make sure that the DHIS2 community knows this is where DHIS2 ends and your product begins, and work together. Sharing that kind of knowledge only increases the value of your platform, our platform, and the people providing the platform to the folks who need the more comprehensive service. Does that make sense? Okay. And so, yeah, I talked about in-kind contributions. Not everything needs to be financial, but we do also want money. So what are the benefits to contributing partners? Again, somewhat early days, but we want to be able to officially recognize them in some form or fashion. We want the world to know these are the people who are good faith actors, who are supporting the global good, who want to see it go forward and survive, and not just survive, but thrive. We want to be able to communicate that to people who are financing DHIS2, who want to, large organizations who want to potentially implement DHIS2 across multiple countries or across multiple sectors, right? Oftentimes people are asking us, who should we use to implement DHIS2? We want to have a list, especially in geographies where there is no, HIS groups are here for LMICs and localization partners. But, if you're in Canada, who's going to support your DHIS2 implementation, right? We want to have a list. In the US, in Europe, where we have not established networks of collaborators yet. We want to have input via forums. We want you to talk to us. We want you to talk to each other. We want you to talk to the established HIS groups and HIS nodes in the world. It's amazing what can happen when people just talk to each other. And we want to make sure that as a platform owner, we're facilitating that dialogue. We want to encourage contributions to the strategic priorities. So again, more voices means that typically we can steer the ship in a better direction. And so we come up with an annual strategy. We want to have your inputs and advice and guidance in that strategy. We also want to make sure you're visible in reports and in global events. And we want to make sure that you have faster support for responses and collaboration. So right now, JIRA is a bit of a black hole. If you have a bug or issue with DHIS2, you don't know what happens to it oftentimes. It just kind of falls into, and then Jennifer or Jim pick it up, and you hope that somehow it gets addressed. This is not working for most people, right? And so what we are establishing is a more structured, formalized process of submitting your issues, and we want to know when they're coming from a contributing partner, so that we know that this is a person who's trying hard, right? They're chipping in. They're a good faith actor, and that their issue is important. It's part of our success. If they are struggling with this, then we are subsequently weakening our own positioning. So I think that we also want to be quite explicit about the differences between the HIS network and the contributing partners. And then what do they have in common? So the HIS network has, obviously you've heard HIS over and over and over again. You already, most of you, a lot of you guys are HIS. Some of you, uh, yeah. So the HIS network, these are our localization and long-time sustainability of national information systems, primarily in LMICs. Why has DHIS2 been so successful? It's the HIS network, right? Has DHIS2 always been the best product? Absolutely not. But we have that localization experts who are day in, day out, oftentimes sacrificing and not making any money at all to keep it alive and relevant to the ministries and partners who are implementing it there. They're going to stay. We need them. And if you are not them, you also need them, right? And you need to figure out a way to work with them. They also are part of the governance of DHIS2. So it's not just the strategy, but it's who are we as an organization? How are we operating? How are we building the platform together? How are we developing the roadmap? The HIS are part of that. The contributing partners are more dispersed in other kinds of geographies where the HIS are not. So they're in higher income contexts. They're operating in sectors and industries where HIS are not always operating. And they'll have a bit of a broader global footprint, even though the HIS are spread out Africa, Southeast Asia, and now Middle East. We also need Europe and the Americas covered. The contributing partners, as I mentioned, will have input to our strategy, and we want to make sure we encourage them as much as possible to collaborate with the HIS when there is opportunity to do so. What are they both doing? Well, they're both ensuring the implementation and alignment of our broader values of sharing, reciprocity, collective action. That's everybody. Everybody is doing some kind of contribution back, so it's either revenue sharing or in-kind contributions. And very importantly, everyone is sharing innovations and agreeing that sustaining the platform ecosystem is of the utmost priority. A little bit on governance and accountability. So that we will coordinate this at the HIS Center. So we will be having the MOUs and the contracts and everything, and then introducing contributing partners to the rest of the DHIS2 community ecosystem. Contributing partners will commit to sharing our values. We'll hopefully publish an annual report saying these are who they are, this is what they're doing, this is kind of innovations that are coming out, and try to be as transparent as possible. Again, the foundation of this is trust. It's a trust-based arrangement. If you are lying to us or lying to the community, or you are it kind of erodes the whole thing. So we always joke, especially if you're not Norwegian, you always joke that Norway is a trust-based society, which is why you see people leaving their babies out on the sidewalk when they're inside getting a coffee. We're taking the same approach, right? We don't want to police you. We don't want to put up paywalls and barriers and that kind of stuff, which is what happens when trust breaks down. We need trust. Trust is the foundation of this whole thing. If we don't have it, it really doesn't work. And which is, again, probably why it's not been done before. So we'll see. Structured feedback loops and risk mitigation. Contributing partners will say we're based on 2 documents. This will be a memorandum of understanding, which is kind of a value alignment. And yes, we all trust each other kind of statements. And then it'll be a contractual arrangement. You saw that we had different types of institutions. So we had academic institutions and then implementers like service providers and others. So we'll have different types of contracts, probably based upon what kinds of organizations they are. We'll have to define roles and responsibilities. And then. And so what have we done so far with this? We have about 25-ish interested contributing partners excited about this. There's actually a lot of enthusiasm about this. People are, to be honest, like I've been working in DHIS2 now for, Ben, how long have I been working in DHIS2? 12 years? Yeah, since 2011. And I'll be honest, it became a bit rote, right? It was kind of the same old for a long time. And they say, don't let a crisis go to waste. Is that the saying? This is the time to get excited again, actually, because we're starting something new. We're forming new collaborations. We're inviting new perspectives. And to be honest, I'm probably the most excited that I've been since I've been working here at UIO about this, because there's every reason this should be successful. The only people standing in our way are ourselves. And so if we all get on board, then we make it successful. Yeah, and so there's quite a lot of these. We're working on kind of the new established relationships. We're also talking to some of the donors and the multilaterals. So we're trying to make the entire value chain align with it, right? So the donors are saying that we're telling the donors, we're coming up with this new partnership arrangement. If you work with anybody to implement DHIS2, then you're working with these partners, right? Or if you want to work with somebody else, make sure that they know about the partnership arrangement so we can get them signed up too, right? And they agreed to that, hopefully. And then, you know, then they have a group of partners that they can work with, and they know that when they work with those partners, there's a contribution going back to sustaining the core. Okay. Yeah, we're getting close to hopefully finalizing some MOUs and contracts sometime in the near future. And yeah, and we're inviting a lot of voices on this. So it's not just us. We've been talking about it with Gavi, Global Fund, Digter, which is a Norwegian, DPG, who's facing similar challenges and trying to build out their own ecosystem, and then also all the other DPG partners, so the digital public goods. So I think, yeah, if you want to join, then you can just email us partnership@DHIS2. If you want more information, Mike and I are here. Please come talk to us. And then I think what we also want to do, it's nice for me to talk at you, but we actually thought it would be really good to kind of hear from a voice from an organization that is interested in potentially joining this, hear their benefits, hear why they want to do it, what their concerns about it are, what their expectations for us or for the rest of the community are. And so, Basoye, we've invited you to say a few words. You can come up. Basoye is lead at BAO Systems, who's been a long-time DHIS2 implementer and collaborator. But, an organization that, fair enough, we've had somewhat of an arm's length relationship with, even though you've been implementing DHIS2 like longer than I have. Yeah.
So not quite bad blood, but I guess being kept like a mistress who's a secret. It's not great blood either. So as Scott said, I'm Busoya Anifalaje. I'm president at BAO Systems, one of the co-founders. I'm based out in Cambridge in the UK. Our headquarters is in DC in the US. Just take a few moments to process that. But we also have entities and offices in Nigeria, in the DRC, in Belgium, Norway via Sweden these days, Germany, Portugal, and Spain. So most of the community know us, and we are known for sort of implementing large, complex DHIS2 deployments. For instance, the PEPFAR data system across multiple countries, as well as working with implementing partners who do a lot of work, again, in multiple countries across multiple sectors. So kind of edge cases. And when I was thinking about this, I wasn't quite sure how effusive you wanted me to be about my excitement to join this partnership. I haven't done since Hammer said, can't touch this. But I felt that organizations are an abstraction of individuals who make decisions, individuals who have different rationalities and motivations for the decisions they make and why they would like to take a particular position on a particular matter. So while I represent sort of BAO and the interests of BAO, it's also important that you hear it from the voice of the individual, my own perspective. When I started in this community in 2009 winter as a PhD student in London, but coming to Norway for the first time, penniless and didn't know how Oslo and how expensive it was. And very fortunately, Kristen took me into her home. Did not charge me. Some of my family members would charge me for the privilege, but she didn't. I felt part of the community, and I think that if I think about why I'm excited about this, I feel like three things about this entire community. One, this journey started for me because I cared about doing good in the world with the short life that I have. And sometimes we forget that because there are bills to be paid, there's code to be written, you still have 20 bugs that you need to fix for Kala. A lot of things sometimes cloud the North Star, which is we are all here, hopefully, because we want our lives to count for something more than just us. We want to do good. And this is why the Institute exists. This is why DHIS2 exists. And this is why we do the work that we do. So that was one. The second, there is a community. And that community is tangible, is palpable. I remember being in Afghanistan and another edge case never been done before. And I was writing to the community here back in 2013, February, saying, would this thing work? And I was getting almost real-time feedback. Bugs are being fixed. I used to submit a lot of bugs when I still knew what DHIS2 configuration was. And there was just a generosity of spirit. I will come here, talk about new projects in the DRC with UNICEF that I was starting on at that time, think through the architecture, and there was support. And so there was a sense of community. The third is, you talked about the kumbaya feeling. I don't think Norwegians leave money outside for anyone to help themselves. There is also opportunity. There is a commercial, BAO is a private for-profit company. So there is, for us, a commercial angle to this and an opportunity to work on this. And we have been able to build a relatively successful business out of this. And some of the foundations of the work that we've done, even to extend the platform, has been through this engagement with community. So what excites me? One is we can do more good. We can definitely do a lot more as an organization together if this platform succeeds and it's sustained. There are new markets that we want to go to. There are new accounts that we would like to see open. There are new places that we would like to be able to introduce DHIS, especially given our foundation working with perhaps not just traditional ministries of health, but also private organizations and multilaterals and bilaterals and commercial public organizations. There is so much more to do. And with our entity based in the US, for instance, that's an untapped market. And I think there's probably another session about working in high income countries. So we see an opportunity there to be able to leverage the association, symbolic value of being associated with the university to open new doors. It gives you credibility, it gives you legitimacy. I know that when we started off, many people, when we introduced ourselves as a for-profit organization, it was almost we had to be apologetic about it. Like, okay, and this is UNICEF, and this is MSF, and this is IRC, and this is BA, and sorry, we are for-profit. Sometimes I still feel we have to do that, but I mean, the opportunities abound. So I think one, in terms of doing more good, that's why we're excited. We can do a lot more. Second, community. The community has been good. They have supported us, and this is an opportunity for us to support the community. I think the best relationships are mutually beneficial. It's not a leech, and it's not exploitative. It's you have done, and we would like to do. And I think there has been some of that. I think you fast-track a few bugs, and I don't think we gave you more than 2 bottles of beer, so it wasn't too high a cost. But we would like to support the community as the community has been supportive to us. And this is good through a social contract. by coming formally signing up to this core contributor program. And the last for us, what we're really excited about is growth, and revenue. Rather than fighting for a small pot, well, we can have more people and bigger pots, and there's efficiency for the donors. There's less administrative overhead when we're collaborating and partnering. So donors are not speaking to 20 different vendors; they're speaking maybe to 4 or 5. And contracts are simplified. Vendor engagements are simplified. But if I came here and said, where's the checkbook? Where can I sign? No concerns, no questions. It wouldn't be completely accurate. We do have some concerns. And I know in the spirit of transparency, it's also good to be able to express these concerns. And some of those concerns are really around expectations alignment. That how realistic and reasonable is it to see what return on investment looks like for an organization like ours? And what is the added value of joining in terms of revenue metrics, of joining a program like this as opposed to going it on our own? And Kristen twice winked at me on the platform yesterday when she was like, maybe we'll fix some bugs, or maybe we wouldn't. Maybe we'll give you a little bit of influence on the roadmap, but maybe we wouldn't give you too much. I know that these conversations are still ongoing because it's still a democratic society, and I think everybody still has value and every voice still counts. So navigating that, okay, we have made a contribution, and how do we track the return on investment to those companies would be a concern. Some of the questions that we still have would be how you mitigate outsized influence on the roadmap, given the contributions made by a few large entities without compromising their own return. So if I stood up now and said, you have 20, this is theoretical, it's hypothetical, I am not committing to anything. If, like right now, BAO will give you $50 million for Chatham House rules. And for that, we would like you to drop the name DHIS2 from this and call it BAO 3.0. Not many people would probably care. But those kinds of contributions that could become a power lever, how do we mitigate it so that we still have the interest of the community at large without having to navigate these high rollers? But I thank you very much for the opportunity, for your bravery, your courage to even try and attempt this to work. But human beings, as we are, at most times fickle, and we may be for it now and down the road. But I hope that the trust can be built, and I hope that the foundations of a new form of working, which is based on partnership, can thrive in this community, and we can go to the next level. Thank you.
Peter, you just joined. Yeah. In a figurative and literal sense. So we wanted to invite and one more additional perspective on kind of this contributing partners from Mr. Ricketts here. Is it doctor? No, probably not yet. You'll get sucked into a PhD program. That's what happens. Peter's representing Open Solutions Health, which is a DHIS2 provider based in the Caribbean, and been doing quite a number of DHIS2 implementations. But a great example of an organization that's completely flown under our radar for a long time. And so we approached Peter once we found out that he existed, which took a surprisingly long time, and told him about it. And so as a new organization kind of to the ecosystem, we wanted to kind of hear what your thoughts were. So potential opportunities, concerns, And then after Peter, we'll open it up and let you guys share.
Thank you, Scott. Good day, everyone, and apologies for being so early. Um, so my name is Peter Ricketts, and I am the CEO of Open Solutions for Health. And essentially, Open Solutions for Health was created to fill a gap in the Caribbean region. Typically, if you look at most DPGs and you look at their maps and you look at the Caribbean region, it's typically blank. And I used to work for the public service for 8 years in the health information unit. And also was fortunate enough to be a consultant for the Pan American Health Organization. And that gave me the opportunity to travel throughout the Americas and see the need for an entity that would, A, be able to provide services to support, well, at the time we did not know they were DPGs, but open source technology, because as you would know, you have proprietary systems, too expensive for us in the region to sustain. But then with the open source or DPGs, you would require that technical capacity. And within the public sector, having that high turnover of personnel made it difficult to sustain any technologies, especially while I worked within the service. So we started to look at the various technologies available and looked at OpenMRS, OpenFN, and others, and also DHIS2. And so the beautiful thing about DHIS2 is that it's extremely well documented. And we were then able to attempt to solve another problem, which was retention of young minds within the country. Because unfortunately in Dominica, the highest level of education that you can get is a state college. We don't really have any universities, so persons who want that tertiary education has to leave, but then it's typically too expensive. So by the time they get that degree, they have to take a loan. They're not going to come back to Dominica, and so experiencing major brain drain. So leveraging the academy, the DHIS2 Academy, able to train up young minds who can then now become productive. And so we have been doing that for the past 5 years. And so we started to help first Dominica by providing pro bono services for the government, with hopes of then building our portfolio, right? Because we can show up to any country and tell them, hey, we're able to solve your problems. And it's like, well, show me. And so we did that for the first couple of years, and was able to implement things like the National Electronic Immunization Registry, Health Worker Registry, and other solutions, both within the health sector and outside. So we actually have a design for a sports management information system on DHIS2, a constituency management information system on DHIS2, and really the applications are endless. And so there was another challenge that we encountered on our journey, and it was, again, how can we prove to our market space that we are capable of doing what we want to do? And so we did approach DHIS2, Oslo, University of Oslo, to inquire about, HISP status. Now, we understood then that the HISP status was more of an not-for-profit, and we are a for-profit organization. It's the only way we can be sustained. We don't have any donor funding. And so we did not qualify as a HISP. So when now we found out about this new program, which was the partnership program, we were like, when Scott reached out, that's why I was like, this is something that we need, not want, because yes, obviously we're going to, by being part of this ecosystem, would be able to, continue to share ideas. I mean, we have the community, now we have the partners. And so, this expected benefits. But for us, it also does give us that visibility that we would require for providing the services that we do. Now, we do not aim to get, big fast like BAO. Matter of fact, I'm so happy that I'm presenting after the SOI, because BAO did reach out to us, and we actually do have a formal agreement to partner. So if there is any projects which are too large for us, we have Big Brother, right? And so, really grateful for that. And really, we aim to really fit or fill that gap whereby what the countries, at least in our region, need is consistency, and that professional handholding, that cultural competency, and really just them knowing that there is support available on demand. And so I even found out that we actually have been functioning sort of like a HISP, because we do provide pro bono support. Every single project that we've implemented, we have WhatsApp group chats. If they do need any bug fixes or any updates, we don't say no, right? Because at the end of the day, what our goal is to see these solutions be sustained. We're trying to solve that sustainability challenge. And so we welcome very much the partnership program that DHIS or the University of Oslo is going to be launching. And yeah, that's pretty much who we are and what we do. We do work with other, like I said, other DPGs, but DHIS2 is definitely at the core. We work a lot with the Pan American Health Organization and other agencies within the Caribbean region. And so, yes, any questions, I'm here to answer all of them.
Thank you. That's great. So we have in this room a number of people that might be considering joining as contributing partners. We also have really strong representation here from the HISP network. And I do think that the relationship between the HISP network and the contributing partners is vital for us to solve and figure out if this is going to work. So I'd really like to invite any comments, thoughts, questions about what we've shared, thoughts about how it will work between contributing partners, how the relationship would work with the HISP groups. Any thoughts to start us off in our conversation? Had to be the furthest part of the room.
I think before we try to tease out the details, which are obviously complex, I wanted to recognize Scott, Mike, and the team for their generosity, frankly, and bravery in trying to figure this out. When I've had maybe the privilege or the curse of being able to start and get out of companies a few times in my career, and the prospect of fundraising is always really scary, because as you look to procure more revenue, you're always giving up sort of organizational control to an extent, or your ability to define your product or your markets or whatever it might be. You tend to contort to whatever shapes and cracks and fissures that the funding environment allows you to do so. And in that position, I think the Oslo team had the very clear option of just saying, we're going to lock the damn thing down, and everyone who uses it is going to pay us a fee for service. That is a very viable and well-trodden fundraising model in the SaaS environment. And that would have cost everybody all over the world, whether you could have paid for it or not. And rather than doing that, they're sort of putting themselves out there and looking for alternative funding streams that would preserve what has become a very lucrative and beneficial platform for us as a community, in a way that would continue to maximize those freely accessible and open source benefits that we've been taking advantage of and benefited from over the last 20 years, but also not do so kind of falling on their own swords, given all the funding cuts that have come through. So I just wanted to recognize that. And I wanted to say thanks, genuinely. Thanks for your bravery and your courage in doing this. Thank you for continuing to find ways to allow the rest of us to benefit from this platform. I do have a lot of concerns, obviously, but I'm more optimistic and positive about the future, knowing that this is the first step that's been taken, rather than a different step, which could have hurt a lot more. So thank you for that, and thanks for your continued efforts.
Can you introduce yourself?
My name is Ben. I'm the co-founder of Across. We've been implementing DHIS2 since late 2009, early 2010s. Scott worked for us for a long time before Kristen and team poached him. And we've had a wonderful career supporting DHIS2 and other solutions and implementations, and look forward to seeing how this is going to play out.
Thanks, Ben. Others, thoughts, comments, concerns?
Okay. I won't say thanks so much. Just I'm shit from Ethiopia. Just in our country, private clinics, hospitals, and government health facilities are using DHIS2. Look, also all of us are here because the software was developed a few years ago. If DHIS2 were not, we are not here really, all of us. Therefore, first I want to say thank you so much, starting from the who developed to until today. Therefore, next I believe there should be a strategy to sustain, for example, long-term strategy, short-term, or maybe middle level. Therefore, their strategy. That's my question. Therefore, how the low level, for example, on all structures, what should we can contribute? Therefore, this is my question. And as a country, also our government is committed to support, and also is supporting us, and there should be strategy at all level. Thank you so much.
Great. I mean, I can give a thought to that one. So this is one model that we're pursuing. We're pursuing various, and we think they're complementary, and we think it's really going to make a difference. You'll hear a little bit more about some of them over the next 2 days. So one of the things that we're doing is initiating a collaborative partnership within the DPGs and talking about how our vendors also can be their vendors and working together and jointly going after funding that individually might have been difficult for any given technology. Not just DPGs, we're reaching out to other platforms as well, trying to make it so that, one, it's a lot easier for countries to be able to use various technologies together, but also we really think there's a lot of financial gain to partnering. There are a lot of projects that one solution wouldn't have won, but combined they can win. A lot of these groups also have donors that we don't have, and vice versa. We have donors that they're not familiar with or introduced to. So that's one of the areas where we think also we're going to be kind of growing the pie, the opportunities for anybody that's doing DHIS2 service provision, and also for anybody that is a client or user that wants to have stronger functionality and better linkages to other technologies. There's another pathway that we're working on, which you'll hear about tomorrow, I think, is our high income use of DHIS2 in high income settings conversation. We recognize DHIS2 as having a mission and a reason for being that is to make sure that it's sustainable and possible for countries in low and middle income settings to have national systems. We did not get all of this work together in this community together so that Norway can have a free system. Right. And so we're approaching the high income settings in a different way than we would when we're working in the global south. And we have a lot of countries and entities in high income settings now that are reaching out to us all the time. We don't advertise at all. We have a very small communications team that works incredibly hard. And people are just finding us on their own, especially after COVID. They've all needed to increase their systems for disease surveillance, for example. And they literally go to Google and they type open source disease surveillance, and then they contact us. So we get contacted by various governments. We're having lots of conversations. Some of this work, of course, what we want to do is pass it along to contributing partners and collaborations with the DHIS network. Some of it is we think directly they can pay a platform fee. We're not licensing it. We're not locking it down. But in terms of having a sustainable DPG, saying, look, you guys would have procured something else far more expensive. You still get the benefits of it being open source. There's no vendor lock-in. You own your data, but you should pay a platform fee.
And so that's another pathway that we're working on. There's more. We're approaching a lot of new donors and new spaces. We have a lot going on in the education sector and other places. So we really strongly believe that between these various pathways, we're actually going to be much more stable than we've ever been. We won't be dependent on the yearly funding cycle of the donors. We think this can start to be a consistent form of funding flowing into the platform. And for us, I mean, it's very important then to maintain the governance. There was questions about that. How do we make sure that we don't get unduly influenced by others coming in? For us, that's why it's vital that we have the HISP network and the University of Oslo, the HISP Center, on the governing side of this, where we have specific values and a specific mission. And that's what we're steering the ship towards. And so we also will encourage, as an open source platform, externals to build whatever they want. That's great. That's not going to change our roadmap. They can build it. It can be a contribution to the community. It can be something that helps us learn about new use cases, et cetera. But we're not shifting our focus away from our mission and values. So I guess that's my.
Yeah. A couple more minutes.
So I started working for PEPFAR in 2013 directly. I'd worked through a partner before then. Well, I worked through funding channels with PEPFAR money, and that provided maybe a forerunner to some of these ideas. Mike Guerin, who was the chief technical officer of PEPFAR at the time, wanted to use DHIS2 for data collection, but was very concerned that he didn't want PEPFAR to distort what DHIS2 was. He didn't want it to be the, wagging the tail or whatever. And he also saw value in contributing to the public good of DHIS2. For 12 years, I was paid by PEPFAR to work part-time on what PEPFAR needed and part-time on the global good of DHIS2 as a core developer. That was part of PEPFAR was also contributing financially during much of that time, but my time as a back-end developer was also an in-kind contribution from PEPFAR to the global good of DHIS2. So this all makes a lot of sense to me because I've been living it for the last 12 years.
That's a good perspective. Just two more comments, maybe up here.
Where did you see first? Sorry.
Joanne, and then just behind here.
Thank you. Thank you very much. And you know how much we appreciate all the work that is going on with your support in the countries. I was just wondering, in the contributing scheme for the lower and middle income countries, everything seems to continue to be donor dependent. And we know how risky this is. We have learned this year that donors can disappear from one day to the other. Have you considered in that scheme, considering governments as contributing partners, that they actually take on part of the contribution to the core development? Yes, there are donors who will continue. Let's hope so. We hope the Global Fund will be among them. But at some point, these donors might slowly disappear, and countries need to have a sustainable way of maintaining the platform. And I think it would be important to have the governments, the ministries of health or the ministries of education make potentially a contribution to that in the big scheme of things.
Yeah, so the pathways that we were describing actually are meant to be able to be adaptable to that scenario, right? We know that right now that's not what's happening because they haven't had to be the ones funding. But that can change, and it will change country by country over time. So, I mean, both pathways, the one I talked about with the high income countries paying a platform fee, and also that the implementation groups that are actually doing the work giving a contribution back. Both of those methods can work in countries where the government is starting to be able to pay for their own support services and their own software. So yes, we also really would like the support from Global Fund and others to help that conversation along. And so I know we've talked a little bit about the possibility of introducing a fee that is covered by donors for a time, but with an expectation that, 3 years, 5 years down the road, then the government is set to take that on and kind of help them along the pathway of doing that. So yes, I mean, I think that that's a part of the long-term vision, is to be prepared with models that will work in those cases as well.
Then one more comment. Then I think that's it.
Thank you. I'm Jackie. I'm from the Wild Diabetes Foundation, and mine is a comment just to say this is welcome for us as an organization that's working as a donor and contributing. We are kind of new to working in digital health, and that was out of necessity because we've been working for almost more than 20 years from a programmatic angle, projects that are demand driven, and we can see more and more there is a need, especially from the NCD and diabetes space. But we haven't really known how to do that as a donor. So it's just fantastic that, having this coordination mechanism at a global level, which we want to contribute and be a part of that, but also be able to increase visibility on the work we are doing on the ground as well, just to see, how do we have visibility and just to ensure that, whatever is being done amplifies and we don't duplicate. So just wanted to say thanks. This is welcome. This is refreshing, and we look forward to see where this goes. Yeah.
Well, maybe Ranga, I'm interested in what he has to say.
Yes,
Please.
perfect. Ranga, leave us with the controversial comment.
This could be real good or real bad.
Okay, I mean,
Maybe
can
introduce
you hear me?
yourself first.
Okay, my name is. I hope you can hear me, please.
You need to for the people online.
Okay. All right. My name is Ranga. I also joined this community in 2011, and I've been part of the furniture around DHIS2 for a long time. So from all the conferences, just a history, everything, we've been part of the process from the very early days. Of course, I joined a bit later than some of my colleagues who are quietly sitting up there, who Seferino is somewhere. So there's a lot of history here. And his groups, I'm actually surprised a little bit that we didn't hear anything from his, because I think they have a lot to say. So just know that as much as I won't be making those controversial comments you expect, there is a lot of people with a lot of things to say. So I think that's going to be important. Just a note on that, even though we won't have time to say everything right now. Thank you.
No question at all there. And we are actively working with the HISP network to talk these things through, because we want to get the definitions right. We want to get the understanding right about how the collaborations work. So all of this will be finalized with the HISP network and their input. And I invite you all to corner them after this meeting and ask questions. We can talk to one another. There's more sessions coming up that there's opportunities to discuss this. So yeah, I think we'll have to close there. Max, was there something you wanted to say before we close? Yes.
Sure. My name is Max. I work at the HISP Center here. I'm the Director of Communications for the HISP Center and the DHIS2 project. And so I see a lot of the traffic that comes in, a lot of the requests that come in. So when we're talking about partnerships, it's good to know that there's a market out there. Just off the street, people we're not already in contact with from other projects, we get between 15 and 25 requests for support for projects per month. We get currently 1.2 million visits to our website every year. So there's a lot of traffic, there's a lot of interest, and there's a lot of stuff we're not capitalizing on, because as Mike and Scott pointed out, we don't have an active marketing strategy right now. We have a passive marketing strategy. We try to put out good information, let people find us, make it easier for people to find us. We don't pay for advertisements. We don't have people going out there as community advocates or champions trying to reach out to new markets. So already, without doing very much, just putting ourselves out there, we are getting a lot of interest, and we're getting more interest from high-income countries, from new sectors. So getting this partnership together and getting a good model, this is exactly the right time to do it, because we can really capitalize on this growing interest and bring DHIS2 into the next phase, basically. So from my perspective, seeing all the traffic, seeing all the interest, I think the time really is now to get this working. So I hope you all join us for it.
Yeah. Thanks, Max.
All right. We'll end with that. Thanks, everybody. We can continue the conversation.
Have a good evening. Oh, wait. Fuck it.